Hello, good morning, good afternoon, good evening, wherever we find you in this session of the course. We hope that this session in particular will be of immediate value to you. We are addressing some of the deepest, some of the most challenging issues confronting policymakers generally, whether we look in the field of trade policy in particular, or more generally the challenges for governance today. Because we're looking at the interaction between public health measures and trade policy measures, including the broader range of trade policy issues, intellectual property, competition policy, government procurement. And of course, there's no way that we can give a really thorough overview of these issues in a short session. This is why we really do place a lot of emphasis on the interaction, the questions and answer session that will follow. So we will set out a very broad outline, go through some of the key issues, the key intersections, but we'd like to shape this in a way that responds directly to your concerns and priorities. So do note those questions, because we're looking forward to engaging with you. Overall, the way I would express it at the moment, and we know this with the shadow of this dreadful COVID pandemic over us all, ultimately, it's a fundamental public good, fundamental objective of governance, fundamental goal is the public health of our populations. And we know that this is not something that is confined to nation by nation, defined by national borders, national boundaries. We know acutely, unfortunately, from this pandemic, that it is an area where international cooperation is essential, where there is strong mutual interdependence. And that's one of the harsh lessons we have learnt from this pandemic. This is why in the Constitution of the World Health Organization, there's the reminder that the public health outcomes in any one country is a benefit to all countries. And this is something we do need to bear in mind when we consider the trade policy dimension. Now, we won't go into the specific details of COVID measures, but we will point you towards some very significant or useful materials that we have. The key point I would get across in this session is that this is an area where cooperation, collaboration, dialogue is absolutely essential. We have learnt this at the multilateral level. Here in Geneva, we have a combination of remarkable expertise. It is, of course, the headquarters of the World Health Organization, upon which we're all reliant for guidance, for understanding of the impact of this pandemic, public health issues more broadly. It's also the headquarters of the World Intellectual Property Organization. We work very closely with that organization to understand the innovation and the intellectual property dimension of public health issues. And it's where the UN headquarters in Europe is based, including human rights experts, experts on development, and of course trade policy, here also in the World Trade Organization. And so my point is that we are all put together here so that we can cooperate, so that we can engage in dialogue, so that we can pool our expertise, because the challenges we face are not confined to our specific, relatively narrow areas of expertise. Important though they are, we need to understand how they fit together. And this has really been the journey we've been on, certainly in the WTO, since its foundation 25 years ago, but in particular since the year 2001, when the impact of a previous epidemic, the HIV/AIDS epidemic, was really being felt in the developing world in particular, and this pushed the international system towards greater collaboration, a more inclusive, holistic approach. And we would always say in working with our member governments, it's very important to replicate this, to apply this approach at the domestic level. So much of our outreach, so much of our capacity building work in this area is not necessarily about the fine-grained policy making that every government has to make. Every country is in a somewhat different position, has different priorities and circumstances, but the need for collaboration and the need for a holistic approach, the need to pull together empirical data, information, understanding to build a common approach is always important, but of course in the current situation is critically important. And that's really the essence of the approach we've taken. In the course of this past year, we have issued a joint study with the World Health Organization and the World Intellectual Property Organization called the Trilateral Study, with the title Promoting Access to Medical Technologies and Innovation. It has the subtitle Intersections Between Public Health, Intellectual Property and Trade. And that really does spell out the necessary approach that we believe is essential for an effective response to public health crises, whether it's the current pandemic or more broadly. We need to understand the specific areas of policy, in our case, trade policy, intellectual property policy. My colleague Anna Mueller will talk about competition policy and government procurement, public procurement. These are all critically important in themselves, but it's the intersections between them that really help us understand how to address public health crises in an effective manner. So I commend this work to you. We'll provide links and access to the material. For the WTO, this approach really came into focus in the year 2001, where, as I mentioned, there was a rising concern about the appalling impact of the HIV/AIDS epidemic, and there were major concerns about access to treatments. Effective treatments had been developed, which really did determine whether one would survive or one would pass away. Early on, a diagnosis of HIV/AIDS was effectively a death sentence for all but a very few. But the availability of medicines transformed this, and we see the situation today, 20 years later, where there is effective treatment for most people suffering from this dreadful disease, and the mortality rate therefore reduces. The public health outcomes are so much better. But there were deep concerns about, at that point, the interaction between the systems we have for innovation, for creating new medicines, new treatments, new technologies in the health area, and access to these materials. Because of course, what's the point of having an effective treatment, or at the moment, an effective vaccine for COVID-19, if it is not universally available, if it's not available in equitable and fair manner, if it's not effectively available. And this is why the innovation aspect, the necessity of new medicines, new treatments, new technologies, new diagnostic techniques, new preventative technologies such as the vaccines that we're hearing about, and equitable and effective access to those materials. And in the current debate this very day about access to vaccines and the disparity of access, concerns about vaccine nationalism, that is exactly exemplifies the difficulties that we confront. For the WTO in 2001, confronted with this earlier public health crisis, trade ministers universally, by consensus, adopted the Doha Declaration on the TRIPS Agreement and public health. The TRIPS Agreement, you will now well know, is the WTO agreement on intellectual property. It deals with the trade dimension of intellectual property. It sets quite wide-ranging standards for the protection of intellectual property, including intellectual property directly relevant to public health, patents on pharmaceuticals in particular, and therefore there was deep concern that the TRIPS agreement, that the intellectual property system should not get in the way of effective access to medicines. This led to the formulation and implementation of the Doha Declaration on the TRIPS agreement and public health, which set out very clearly that the intellectual property system, the TRIPS agreement, have to be part of the solution, have to be interpreted, applied, implemented in a way that is supportive of governments achieving their public health, desired public health outcomes. And we do see both legal implications of this with an amendment to the TRIPS agreement, which has since been amended in order to create a new pathway for the most vulnerable countries, for those countries that do lack production capacity for pharmaceuticals. A new pathway, a legal pathway for those countries to get access to medicines. And so this was the first amendment not only to the TRIPS agreement, but to the entire package of WTO law. A debate continues even today about whether this is effective, whether this is enough. And indeed, right now, our members are discussing whether the TRIPS agreement should be in part waived at the moment as a means of promoting access. And we are right in the middle of a very intensive debate across our membership about the right measures to take in this area. But I would say that the Doha Declaration remains very important, both for those legal consequences, but also for the signal that it sends about collaboration, about looking at, in this case, a WTO agreement in a pro-public health way, in a way that is supportive of public health outcomes. And this really did affect the way we work. It really has galvanized, it has transformed our cooperation in the multilateral system, particularly with our partners such as the World Health Organization, but more broadly at the regional and domestic level. And this is why in our work we are just as likely, if you like, in the field of intellectual property, to be dealing with obviously intellectual property experts, but also public health experts, representatives of health ministries and the like. Likewise, our engagement with civil society and industry reaches across the spectrum of all those interested in public health issues. And I think that the Doha Declaration really set the signal that this was essential. This was a requirement, and of course, we've seen the practical necessity of that, even in the current health crisis. One thing that the Doha Declaration did in the field of intellectual property was to underscore yet again that the intellectual property system does not exist for its own sake. It is part of a nation's economic governance designed to promote not only innovation, but also access to the fruits of innovation. And the one element of the TRIPS agreement I'll mention to you today is Article 7, because that, for the first time in multilateral law, set out why we have an intellectual property system in the first place, its purpose. It states that the protection of intellectual property rights should contribute to the promotion of technological innovation, fine, to promote in this case, the development of new treatments, new diagnostic tools, new vaccines, but also to the transfer and dissemination of technology. Availability of the technology is critically important. The public expects to benefit from these new technologies. And that's why it says that this should operate to the mutual advantage of both the producers and the users of new technological knowledge, and that this should promote social and economic welfare and lead to a balance of rights and obligations. When my colleague Anna Mueller touches on the question of competition policy, for example, she will be exploring the boundary between rights and obligations in the intellectual property area and its application to public health. So we often talk about balance when we talk about the intellectual property system, and that remains critically important, achieving the balance in practice. This is not a theoretical matter or a static matter. This is a constant dynamic challenge, and it's one of the most difficult and challenging aspects of intellectual property today. We do have more to work with today than we did have 20 years ago. We do have a better understanding of the innovation systems and how they work. What are the factors that enable and support innovation? And we're seeing an emergency crash course in this in the current pandemic. And the critical point to understand is, of course, no one single factor determines whether innovation occurs or not. there's a whole host of factors that lead to innovation, and we can't rely on any one mechanism or another. It is a complex matter, it is a complex problem, it needs a complex solution. Likewise, when it comes to access to medicines, intellectual property is one of the critical issues concerning access to medicines, but it's not by any means the only one. And we have now much more experience in looking at various government interventions, various initiatives, civil society and philanthropic initiatives that help to ensure access to medicines. So we have a much richer base to work from, so that we don't merely have the prospect of a somewhat political, abstract discussion about how to achieve that balance, how to achieve those social and economic welfare outcomes. We have a better practical understanding of what is required. That said, it still remains enormously challenging. We only heard about this coronavirus just over a year ago, and it presented instantly a new challenge, both for innovation, for the creation of treatments, for the creation of vaccines, but also for the dissemination of these vital technologies. And so the holistic approach is not an abstract approach or a theoretical approach. It is a practical demand. For that reason, we have had to gradually broaden our perspective on these issues from what in the past was a fairly, I might say, polarized discussion about, well, do you want innovation or do you want access? We can promote innovation, but that will be at the cost of access to treatments, or we can push for access at all costs, and that will inhibit or deter from innovation. Well, we now know that it is a more complex picture. We're now used to talking about a wider range of concerns and policy measures. For example, for many governments, access to medicines is really about procurement policies. We have a certain budget, we have certain resources available. We want to get as many treatments as possible, as many vaccines as possible for those resources. And at a time when public resources are under enormous pressure, if we can get, very bluntly, half the price for a medicine, we can treat twice as many people. Equally, we need to look at trade settings, where there are tariffs on medicines, where there are delays and costs, problems addressed by the Trade Facilitation Agreement. This translates directly into access to medicines, directly into the cost of gaining access to medicines. And of course, intellectual property, where there are cases where intellectual property impedes access to medicines, governments have very considerable powers to intervene, to set aside the exclusivity, the constraints of intellectual property rights, and to provide public interest guarantees. These are very controversial perhaps in some of the discussion, but to my mind the principles are very clear. The intellectual property rights are certainly not absolute, and there is a very clear understanding that the public interest is what is paramount, and governments do have the entitlement to address the public interest, and there are ways of containing or restricting the effect of intellectual property rights where necessary. This has led us to develop, in cooperation with our partners, the World Health Organization and the World Intellectual Property Organization, a much broader framework that does accommodate each of the specific areas of expertise that are necessary, ranging from human rights expertise, competition policy expertise, innovation policy expertise, trade policy, patent policy. All these areas, they are important, as they are around the perimeter of this graphic, of this image. But really what is important is what is at the center of this image. The critical need for innovation and access, the creation of new technologies, and the guarantees that access will be available, will be fair, will be equitable, will be effective. And that means we draw together the broad areas of policy. Public health policy, that's at the top of this chart. trade and commercial policy that affects the affordability and the degree to which we can rely on the private sector to deliver and disseminate technologies, and intellectual property and related innovation policy. Because indeed, we've seen from this pandemic that without innovation, we have no cures, we have no vaccines, we have no way of containing this pandemic. So I now pass the floor to my colleague Anna Mueller, who will focus on some of these specific areas in her expertise relating to public procurement policy and competition policy. But I hope in this very general sketch, this overview, this introduction, I've raised some of issues and some practical considerations that are valuable for you. But as I say, I really look forward to the interactive discussion, because we'll be able to zero in on the specific areas that are of concern to you, and I hope come up with some practical responses and ideas for future cooperation. So I thank you very much for your attention, and I pass now to my colleague Anna Mueller. Thank you.